Good evening and thank you for joining us. I'm Caitlin Arla. Jason is off tonight. As a number of COVID hospitalizations continue to rise here at home, MVHS officials and employees say capacity and staffing concerns are growing.
We are rapidly approaching capacity within the Mohawk Valley Health System.
The hospital is now implementing their surge plan that was developed in the spring to allow for more patient care. As patient numbers rise, staffing levels can't keep up.
We do have available rooms and beds in the hospital, but there is absolutely not the staff to take care of them.
Lily Warrenzak is a nurse at St. Elizabeth's Medical Center. She says she is worried about the patient-to-staff ratios.
On med-surg, sometimes the nurses are taking up to 14 patients. A safe patient ratio for med-surg would be 1 nurse to 5 patients, so they're almost tripling what would be considered safe by many standards.
Dr. Ken Hall acknowledges that there is a staffing shortage.
There was already a pre-existing shortage, for example, of nurses. There was a 1.2 million shortage of nurses across the country before the pandemic hit. And then you add to that the fact that nurses, being human beings, are going to get sick. We have a number of our staff that are currently out sick with COVID and therefore are not able to work.
He says they are doing what they can to recruit more nurses, but Warrenzak says it's not enough.
It's not aggressive, and they need to be more aggressive if they're going to get people in.
She says the bottom line is that patients are not being cared for the way they should be.
The patients are suffering immensely. It brings tears to my eyes. It brings tears to the other nurses and healthcare workers' eyes, just, knowing that they're not able to provide the care that the patients deserve.
But Dr. Hall says starting on Monday, non-essential procedures will be put on hold to free up other staff members.
We calculate that in doing that, we will free up probably about 28 to 30 nurses and about 12 to 15 clinical assistants that can help the nurses on the floor.